Professor Bongani Mayosi, brilliant researcher, clinician, leader, friend and family man, was born in Mthatha in the Eastern Cape on the 28th of January 1967 and died in Cape Town on the 27th of July 2018. His legacy is immeasurable and continues to inspire people across the University of Cape Town and way further afield.
Professor Mayosi was the most inspiring and most visionary person I knew, and he saw the world not as it was, but as it could be.
He made an impact early on in his life. The young Bongani was the toast of the student community when he was top of the class at the University of KwaZulu-Natal.
I knew him from varsity days. We were in the same class in 1984. It's very rarely that you find a brilliant and exceptional mind and at the same time being as humble and gentle as he was.
Throughout his career, Professor Mayosi made immense contributions. He transformed the Department of Medicine at UCT to become the largest and leading medicine department on the African continent. He also made it more inclusive.
He made being an academic cool. So a lot of young trainees and black ones in particular who would have gone into private practice now saw somebody like them who was an academic and they aspired to that, and we've seen a burgeoning of a number of black trained cardiologists and other black specialists coming out of this department.
Professor Mayosi also brought other universities into the fold.
As the University of Cape Town rose through the ranks, he felt it critically important that it reaches out to the Walter Sisulus and the Sefako Makgatos of the world to say how, as we are developing these programs, can we do this together so that you benefit from the fact that the University of Cape Town is getting better. That was a key, well thought out, well developed plan of his.
As a researcher, he was a global leader in the field and a doyen of heart muscle disease on the African continent.
A major thread of focus that ran through all of his work was the commitment to contribute to a better understanding of cardiovascular disorders of the poor. And in that body of work, he focused greatly on understanding heart failure, cardiomyopathies, HIV-associated heart disease, as well as tuberculosis involving the outer membranes of the heart, or TB pericarditis as we call it.
Professor Mayosi's discovery in 2017 of a new gene for arrhythmogenic cardiomyopathy that causes sudden death in young people was recognized as one of the most important medical advances made by a South African scientific team since the first human heart transplant. Professor Mayosi also made a breakthrough in rheumatic heart disease.
What he was able to do in rheumatic heart disease is put that back on the agenda. Through 10-15 years of work, he created a momentum with the help of others, but that ended up putting rheumatic heart disease front and center on the agenda of African organizations, World Health Organization, World Heart Federation, United Nations.
Professor Mayosi published over 350 peer-reviewed articles and book chapters during his lifetime, while many more have been published since then. Many of his papers have been converted into policy and adopted by global organizations. He's also made important contributions to the strengthening of health systems in South Africa and other African countries. Professor Mayosi's impact on the institutions he led was far-reaching.
Part of his transformative agenda was to help these institutions really become forces for the greater good, okay, to fit into his grand vision and his purpose. In that sense, he was truly the Madiba of medicine. He was able to inspire excellence, greatness, because that's what he believed was right for Africa.
Professor Mayosi used research to advance his dream of 1,000 PhDs in 10 years in South Africa. He was much loved by his patients, while those he supervised described his open, courageous, and generous traits.
I think just the commitment, the energy, the enthusiasm, the real deep love of science and academia. He always said how you would always live on in your publications. He said those would live forever. He would always come up with something just right or just interesting or just out of the box that we hadn't thought about. And then almost turn it around that it maybe was your own idea, but it never was really.
Professor Mayosi won numerous awards and accolades, including the National Order of Mapungubwe Silver in 2009 and an A rating by the National Research Foundation. His colleagues and students have told of his legendary sense of commitment, even in times of armed conflict in African countries.
A few of us had committed to going to the Yemeni Heart Conference. But unfortunately, it was around the time when a big bombing had just taken place at one of the hospitals. And so many of the international visitors, in actual fact, all of them pulled out. And we had naturally said, Bongani, I guess we're not going. And he said, no. We work where angels fear to tread.
Professor Mayosi also set up ethics committees and health research teams in under-resourced areas in Africa.
Bongani would say, listen, if there's no ethics committee there, we'll help them form one. And so that we leave a lasting legacy. There's no training in data management or in good clinical practice or research methods. We go in there, we do the workshops, we go in there with the highest quality. And even if there's 4 people, we treat it as if we're talking to 50.
Professor Mayosi is widely remembered for the positive effect he had on people everywhere.
He had an infectious optimism, and whenever you met him, he made you believe, and you always saw yourself much better than you actually were.
You know, it's kind of like, well, Bongani believes I can do this, so of course I can. You know, he had that impact. Again, it's amazing the number of people that you run into who have a very similar story.
Always up for a dance, many have spoken about how he embraced life and cared about others.
You know, they talk about gentlemen. He was a gentleman.
Above all, he had an absolute love of his family.
He worked very hard and spent a lot of time in the office and traveling, but when he was home, he gave his all to his family. He always spoke very fondly of the support and love that his wife and daughters, as well as his extended family, always provided.
Professor Mayosi's colleagues say they'll carry his life lessons with them wherever they go.
One of the classic ones is lift as you rise, which you always talked about. But that's how we should deal with people every day, that whatever we do, we should do it for other people and do it in that kind of way. And that was what he did all the time.